Right. Good afternoon, all. Welcome again to another session. This is a very important and significant announcement today. And I, first of all, congratulate the entire Maharishi Ayurveda team. And we have Mr. Deepak Sharma with us. So, first of all, I appreciate, and as a platform, we are always looking for good and ethical companies. And our aim and our objective is to uplift Ayurveda practice and to empower Ayurveda practitioner. And for us, I think there are several companies, there are many options available, but there are few companies who have maintained their quality and their performance, their efficacy, entire thing as far as the medicine portfolio is concerned. In which one name I'm listening from last, in fact, I remember when I was in college, at that time also our teachers, our seniors used to say that, boss, you can always rely on Maharishi Ayurveda for the quality. I think that credibility and that quality is maintained throughout my journey of around 22 years now in Ayurveda. So I can see that. So first of all, congratulate and appreciate to the entire team leading by Mr. Deepak right now in Maharishi Ayurveda to come forward and uh, have that mindset to associate with Ayurveda doctors and practitioners. That is again a very important and significant step they have decided, and today we'll be discussing in detail. So I know that all of you are very much eager to understand what exactly MAC is, MAAC, and what exactly the benefits it will be giving to the model will be giving to the Ayurveda doctors. So I think everybody is well aware about Maharishi, the medicines, the products, but maybe you're not aware about the MAC and the entire aspects which will be moving forward will be discussed with you in this session today. So let me just get an opportunity to introduce Mr. Deepak Sharma ji, and he is having more than 25 years of experience in entire pharma sector. He has worked with several allopathic as well as Ayurveda pharmaceutical companies, and right now taking care of sales, marketing, and training in Maharishi Ayurveda from around 9 to 10 months, last 9 to 10 months, and he has been to various leading positions in management and other portfolios in his career of more than 2 decades. So I think we are very much lucky to have a senior and seasoned professional like you in a Ayurveda company, which is I think very much required. So without wasting much time, I will hand over the session to Mr. Deepak Sharma ji. My request quickly to you, sir, is please brief the entire fraternity who is listening to you right now. Maybe you can give a background about Maharishi Ayurveda, but now what exactly the company is looking forward and how you are enhancing and fortifying your relationship with the Ayurveda practitioners and doctors. Please throw some light on that aspect as well. Thank you. Over to you, Deepak. Thanks.
Thank you, Dr. Piyush. Thank you very much for this wonderful introduction, and not only for the mine introduction, but also creating this platform and giving us opportunity where we can share our vision and our future plans as if what Maharishi is thinking all about. So thanks once again for that. Before I start talking about Maharishi and the aspect which is the topic of today's interaction, I also want to thank all entire the medical fraternity, not only joining us today, but also, I mean, creating a benefit to this patient's life and serving the humanity in a real sense. So thank you to all the doctors fraternity. Thanks a lot. Okay, so I come to the main point. This is the today is the I mean the occasion is the MAC launch, which is actually nothing but it's a Maharishi Ayurveda affiliating centers. So the idea behind the MAC is that as a Maharishi pharma organization, how we can connect directly to our customers or the core partner in this mission, which who are actually the Vaidyas and the doctors. So this is all about that. But before talking on the MAC, I just want to talk about our company first. I think whenever we talk about the arranged marriage system, which is I think is a Hindu religion system, whenever in case of arranged marriage case, we never rely only on the boy or the girl merits and demerits. We always try to find out what is the family background or what are the actually I mean the entire history of that particular boy where it actually belongs to that. So just to know the culture and this aspect where all the merits of this boy. So considering that aspect in this relationship of medical companies and this doctors, I think the same concept lies here also. because whenever this company and the doctors meet together, it is not only the product which doctors should look onto that, but also it is the company background which plays a very important role while selecting the right product. So taking that point forward, I think this is a time when I should talk on Maharishi is what is it is all about. What is the background of Maharishi Ayurveda? So taking this point, Maharishi Ayurveda is approximately 40 years old organization. Unlike the most of the pharma organization, Maharishi Ayurveda, it's not, I mean, the starting with the vision of the commercial setup and all. We have, I mean, created this entire organization under the inspiration of our Guruji, which is the Maharishi Mahesh Yogi ji, for creating the one vision, which is the creating disease-free society. And taking this vision forward, we have done maximum, I mean, many of the things which is making today Maharishi Ayurveda unique with most of the Ayurveda companies available in the market nowadays. So I will highlight two, three core elements about Maharishi Ayurveda. In these 40 years, actually, we are the one company which is having own manufacturing units in Noida as well as in the Faridabad. Both are in the state of the art manufacturing units where we have all kind of certification, whether it's a WHO, GMP, you can say the Ayush premium brands we have, and the many more. So almost all kind of certification we got. Not only that, in these 40 years, we could establish ourselves in the international market, and today we are present in more than 40 plus countries. So not only India we are having our operations, but also we are very strong in the Europe market and the rest of the world. In fact, I would like to mention here that Maharishi Ayurveda was the first company which started its export products in the US and UK market. One thing I think that's a core difference, because I have worked in the both of the therapy areas, Ayurveda as well as in the allopathy. I think the allopathy has worked really hard in case of the documentation, trials, and clinical researches, where most of the Ayurveda companies, I think they are lacking behind. So in that segment, I think Maharishi Ayurveda plays a very important role to, I mean, pushing this Ayurveda industry forward, because in these 40 years, we have done the highest clinical researches. In fact, we have almost 800 plus clinical researches. In fact, I would like to mention here that we have the one product which is having almost 79 clinical trial on a single product, which you all know as by the name of the Amrit Kalasha. So why I'm putting all these points here is that whichever the company right now we are talking about Maharishi Ayurveda, it's not just an ordinary company. This is the company which has the strong fundamental values, which is the company which believes in the standardized the processes, which is the company which believes in the quality medicine, because our main aim is not to earn money from by selling the products, but our main aims to provide the best quality medicine to the patients and to spread the awareness of Ayurveda by and ultimately creating the disease free society. And that is the reason we are not only specific to the product building and all, we also are into services. We are having our hospital setups. We are also in educating the medical fraternity by offering the various courses like pulse diagnosis and others. So we are working, I mean, very strongly in that. So now I come to the main point. Why we are, connecting today is that, which is Dr. Piyush has rightly mentioned. This is today is a launch event of Maharishi Ayurveda Affiliate Center. So what is the need of that? We have realized that actual need of doctor are basically four. The first thing is that as a doctor you need a quality medicine. I think this is the check mark, because Maharishi Ayurveda definitely, as I just mentioned, that how we are providing the best quality medicine. So there we have find no issue. The other thing is that they want the knowledge. They want to enhance their knowledge, because as a doctor, I mean, throughout your lifespan, you need to increase your knowledge. So I think there also we are working very hard by creating awareness in terms of organizing lots of CME programs, lots of small circle meetings, like which we call doctors group meeting and all in the different topics. And not only that, we are also, I mean, providing this educational courses and all. So this knowledge enhancement also we are very strong. The other thing which doctor looks on that how they can increase their OPD, their number of patients. There also we are working a lot by, I mean, how we can help doctors by increasing the number of patients by organizing the free medical checkup camps, like this diabetic detection camp by providing this glucose in case of this glucose monitoring strips and all. Also we are into this BP monitoring camps. We are also providing the free sampling to the doctors in this various kind of camps. So this is the way we can, I mean, attract the patient, or we can diagnose the new patients who are, I mean, maybe the future patient of this diabetes and all. So this aspect also we are working a lot. But the one aspect which we feel, I think we are lacking is that the because most of doctor, when we talk, it's the margin and this the commercial aspect, because that is also very important. So there, because we have to follow the certain processes, and we can never compromise in the quality. So at our level it is very difficult to, I mean, the pass on the high margins to the doctors, because the cost of product is also very high. But this is the time when we find out the solution by, I mean, the looking at the different channel aspect of the distribution of the products and all. And by this is the way we can directly connect to the our doctors. So as an organization now, what we have decided, that why not directly connect as a business partner with the doctors. So this is the reason we have today this opportunity, and I'm very glad to announce that now we are going to connect directly with our customers with this innovative methodology, which is called Maharishi Ayurveda Affiliating Center. This is not a franchisee. This is not, I mean, any kind of some pressurized selling and all this thing concept. But it is a direct partnership with the company and the doctors. Because what we believe that if we have to, I mean, spread this awareness of Ayurveda or creating the disease-free society, which is our mission, we cannot do this thing without partnering the Vadyas, without partnering and the providing the maximum benefit to the doctors. So that is the reason we are, I mean, the raising our hands towards this doctors, just to shake our hands with them and want to grow together. So with this kind of model, what we can offer you as a doctor fraternity is that right now our whatever the doctor, I mean, getting discount from our current business model, approximately 10% additional benefit and discount benefit they will get by connecting directly with us. Apart from that, it's not only this additional benefit to the brands or the discounts theme. We are also trying to, I mean, the market their clinic by providing them the some innovative style of remodeling of their clinic, or maybe this external marketing of by their some boards and all these kind of things. So some, not only some internal clinic we will I mean, modify, but also some kind of marketing we will also do on behalf of the doctors. We are also planning for the some incentivized things like we, I mean, in the regular interval we will definitely announce some additional brand benefits or brand offers for our doctors, exclusively for these doctors who will associate with us with by this model. Not only that, we are also thinking on to provide the free courses, like we are having this pulse diagnosis courses and some kind of other educational courses. So we will also provide that also, considering some kind of criterias. Not only this, we will also, I mean, going to announce some international conferences participation with this. Also we will provide some kind of retreat center visits and for 3-4 days with this family and all. So various things which we can, I mean, going to offer to doctors who are going to associate with us with this kind of program. I know it is very difficult for me at this level to explain the entire thing in this short span of time, but I think you all are registered with us, and you can, I mean, see my number also on the screen. So this way we can connect each other. Our team will contact you. You can contact us. So by that, at that time, we will discuss in detail the entire model of this, how we can associate or how we can partner with each other. But by saying so, ultimate goal is that it's a time when we can, I mean, come together and we can grow together. So thank you, Dr. Piyush. If anything I can could not answer, or maybe something I have missed, I think you can point it out now. Thank you.
Right. Thank you so much, Deepak ji. I think wonderful initiative, and that was need of hour, because see, we always promote and we always convey this to all the practitioners that as a practitioner you are ultimately connecting to the patients, and in Ayurveda, especially as all the medicines are not available at each and every medical store. Although Maharshi has taken a very good, like I will say, a stand in that at least Maharshi medicines, some medicines are available at many chemist shops. I have seen that your Amrit Kalash, your Kasni syrup, and some medicines are easily available, but not all medicines. You are also not
Yes.
able to maintain that inventory logistic challenge, because still that is a challenge. So if either the doctors are having the entire inventory with them, and people who are having issues can take medicines easily, and doctors can also prescribe, and that's why, like in Ayurveda, in a practice we need to maintain a dispensary and we need to maintain the stock. That is a challenge, that is an issue with the entire ecosystem. That is not a it's not an opportunity for us, it's a challenge for us as well, because maintaining that entire stock inventory, everything is a huge investment and a huge expenditure, liability also on us. But still, if we are connecting with the company directly, at least we can get the maximum benefits, and that will be directly passed on. And it's on not only about the financial benefits. When a company connects with certain doctors, they know about them. As you said correctly, Maharishi is already actively involved in conferences, in training. All the other doctors can get an opportunity to groom themselves and to grow, and Maharshi has that platform. In fact, Maharshi is one of the leading organization. I want to convey this to the entire fraternity. I think many of you still know, but still they are the leading organization. Their sister concerns, their other organizations in the other part of the world, they have one of the best and exhaustive network of Ayurveda among the world. In fact, if you talk about certain leading Ayurveda practitioners जो भी आप देखते हैं, हमारे सीनियर्स, कुछ लीडिंग आयुर्वेदा प्रैक्टिशनर्स, आई डोंट वांट टू नेम एनीवन, बट चार पांच ऐसे प्रैक्टिशनर्स हैं जिन्होंने अपने कैरियर की शुरुआत महर्षि से करी थी। महर्षि आयुर्वेदा के बाहर के सेंटर्स पे वो लोग गए, यूरोप में गए, नॉर्थ अमेरिका में गए, दे वेंट टू दिस लाइक जो आपका CIS कंट्रीज हैं, रशियन सिनेरियोज हैं, वहाँ सब जगह, एंड देन दे गॉट कनेक्टेड with the people there, and now they have established their own brand, and they are huge, they are doing huge business, which is good, which is fine. Maharshi Ayurveda always have that mentality that the entire fraternity should grow, right? So now I think Maharshi is coming forward and they are shaking hands with all of us, that we should. And there was one more issue prior, I was like talking to certain doctors, that in many cities still Maharshi Ayurveda local sales team is not available, and they had a challenge of getting medicines, नहीं मिल पा रहे हैं, stock का issues हैं. So now this challenge also has been addressed, as Mr. Deepak personally is sitting in front of all of you, and he's personally sharing his direct number. But one request is always, please WhatsApp first, and then maybe the team will be connected. The number is flashing on the screens. So वो खुद आ रहे हैं सामने. The entire team is coming forward to help you in that. You are at any place, any remote, say remote place, village, town, but wherever you are practicing, they will be ready to dispatch to your address all the medicines and all the products which you are having the requirement. They have certain terms and conditions which you can discuss on one-to-one basis. But that challenge has now been addressed, because the central team from the head office is connecting all of you directly. And in that extent, there will be the maximum benefits passed on to you. And you all know that Indian Vedyas does not promote the commission model. So any sale, any business you all will be doing with Maharishi Ayurveda, we have nothing to do in that. We are just connecting you. We don't have any financial or vested interest in any kind of business any one of your doctor is doing with the Maharishi Ayurveda company. Now, Mr. Deepak, couple of queries here
Yes,
I
sir.
received in my WhatsApp as well.
Right,
First
sir.
is some doctors are asking, do you have any kind of like foundation, any exclusivity bond or anything like that, or it can be simple multi-brand model that मेरे पास और भी companies का medicines हैं and I can have Maharishi medicines also. So ऐसा कोई model तो नहीं है ना कि आप अपना बोर्ड लगा दोगे और हमारा क्लिनिक हाईजैक कर लेंगे?
So let me clarify that aspect, sir. I think as I mentioned also that it's not a franchisee model. It's not like that. And whatever the marketing aspect, also I have told you that we will help our doctors to in marketing their clinic. It doesn't mean that we will, I mean, market our company. It is up to them. Whatever they will approve it, then we will go ahead for that. At the same time, when we talk about this minimum purchase value and aspect of that, there is nothing, I mean, the foundation like that. Right now, all the doctors who are associated with the Maharishi, the average business size is approx 10,000 business they are giving to us. So I mean, if we are, I mean, supplying directly to the from the company, or we are managing the high kind of incentive system, The minimum value which we have kept is just like the 15,000, which is I think bare minimum that. And at that time there is no foundation of the brand also. I mean, the entire range is available for them. They can, of order any kind of product. At the same time, there is no foundation for the monthly purchase also. So there is no foundation in any case of that. Only thing is that because we have to manage supplies for the centralized thing, so we have to keep a minimum ticket size that is a 15K. So nothing apart from that, there is nothing foundation. There is no foundation at all.
Fine. And second question is like whenever we are discussing these kind of models, so there are some more apprehensions as well in terms of like for example, right now there is an ecosystem where a doctor is dealing with your local sales team and they are taking
Yes.
from a particular distributor, or so that channel is established. Now, if somebody wants to get involved in Maharishi Ayurveda Affiliate Center, so is it the same thing which they will be doing, or the channel will be changed, or so, for example, if my clinic is there, your local sales team person is visiting, and my staff is putting order, and I think your certain distributors are authorized, and they are supplying to our clinic. So, what will be the model in future also for doctors who will be sitting with MAC? That also, please, if you can explain.
Yes. So basically, this is the hybrid model. It's like suppose those doctor who are already having some associated with us and already buying our medicine from our local purchase and all this thing, there is a no change will be happen. How we will manage the high discount? That's our headache. We will, I mean, manage that aspect. And those doctor who are not associated with us, maybe in that case we will supply directly. So in both options are available to the doctors.
So, you mean to say all the doctors can take advantage and
Yes,
can
yes, yes.
get involved
Absolutely,
and enrolled in Maharishi Ayurveda Affiliate Center?
absolutely, absolutely.
Right, great, great. Now, a couple
Idea
of
is
more
that
questions.
we have to partner with maximum number of doctors because we want to spread the benefits of share the medicine to maximum number of people.
Sure. And second point is, I think that also you have already clarified many times, but just to recollect. So, whosoever is already doing any kind of business with Maharishi, and if they are getting associated with Maharishi Ayurveda Affiliate Center, definitely their benefits will be increased in whatever proportion or in whatever ratio, depending on the monthly business they are giving. But at least you are saying 15,000 should be there, right?
Yes, yes, absolutely.
Great, great. Then I think 15,000 is not an issue. Maharishi has a exhaustive range of medicines, and in fact, we will be doing each and every. There are more than 30. I repeat, there are more than 30 proprietary medicines Maharishi Ayurveda is having. And see, I don't want to sound like I am advocating them or I am promoting them, but as a clinician, everybody we all know from last so many years that we are using in our clinics the medicines, and they have excellent results. In fact, they are one of the few companies who have done clinical trials in the pioneer institutes like All India Institute of Medical Sciences, AIMS of allopathic, and many other leading national as well as international institutes and renowned organizations. So I think that entire data is available in public domain, and we will request the entire team, Mr. Deepak and the entire team, to schedule regular sessions now on our platform to showcase those clinical trials and research studies to the fellow practitioners and doctors, to talk about each and every proprietary or patent product in detail, because sometimes when a local sales team person is visiting the clinic, so many times we are not aware. I recently went to one event, I think few months back. I met some doctors who are exhaustively like writing some Maharishi medicines, but still they are not aware about all medicines, and we also sometimes struggle as a practitioner. So if at least each session we can have one discussion on what are the benefits, what are the results, the efficacy. The best thing which I liked about your medicines is we can replace a single tablet of any system of medicine with your single tablet. Like for example, we are using Cardimap right now, so we are placing one or two tablets of Cardimap with any good antihypertensive they are taking in allopathic or any system of medicine, and we are getting in fact better results than that. So that kind of practice we are focused, and we want companies like Maharishi to take up and to address that. And last query is there, which I think many people have raised in past as well, and there were some confusions, but I want to clarify on this platform today as we are starting with Maharishi. So you have a USP of doing Nadi Pariksha training. You have announced as well in World Ayurveda Congress. Any updates on that, especially as we are right now discussing today? So because all these doctors are connected to us, and this video will go to the entire fraternity. So any recent updates, any forthcoming batch, anything which doctor can connect, or the same number. I think if anybody is interested in Adi Pariksha training, they can connect with you on the same number. Any updates you want to share on that,
Sure,
Mr. Deepak?
sure, sure, doctor. So basically, I'm thinking the entire course. I mean the program and everything has been already designed. The first batch we are going to happen in the Bangalore. 24th is the date. So we have already registered many of the doctors in the Bangalore. So 24 to 27 we are going. So not 27, 29 is the date. It's a 6 days program actually. So this is the first batch we are going to organize. Then the second batch is in the Delhi. So every I think 1 month or two gap, depending on the batch size, we are going to organize these courses. So that has already been planned in.
So
So
as
I
far
think,
as Bangalore,
we will share
sorry,
that link also to those doctors who are interested in that. So they can register themselves, and accordingly we will create the batches.
so as far as Bangalore, you are saying is on 24th, right? This month, 24th
24th,
January, you are saying.
24th of Jan.
Okay, great. So any still seat available, or entire seats are closed?
Seats are available. So
Hmm.
many registration has already been, because we can still accommodate one or two people. That's not an issue. So if still somebody is interested, we can manage that. So I think
Great.
we will share that link also with that, so people can register with this, and our team will contact them.
Great, great. Mr. Istavan is also he's also joined us from Hungary, Budapest. So great. I think Mr. Istavan, you always support us in many aspects. Dr. Sudhir Pandey is there from Kanpur. I'm just quickly checking some inputs. Right, fine. And as far as the last, I think, concluding remark, as far as any doctor now wants to connect with you, so the process is simple. They have to WhatsApp you on the number which is being flashed on the screen. And also, I request after this session, I request my team to please post these credentials. We are right now parallelly going on LinkedIn, YouTube, Facebook, Twitter, everywhere. So please post a comment in the comment section. Please post the WhatsApp number. In fact, the better you can post the WhatsApp direct link of this number so that they can just click and connect with Mr. Deepak. And also, I request my team to post the email ID of Mr. Deepak as well, so that if anybody
Sure.
wants to connect on email, they can connect you on email as well. And whatever doctors have registered with us, our team will be sharing the data, so all the doctors can be connected in detail. Anyone of you needs more information, please feel free to connect with Maharishi team. I think this is an excellent initiative. We are very much happy and pleased to launch that on our platform, and looking forward to have many more sessions with you, Deepak, and your team. And
Sure.
we are very much positive about this initiative. In fact, you can enroll my clinic as the first MAAC center. I am very much
Yes.
looking forward to have this initiative in all the associated clinics we have, because this will definitely empower Ayurveda practitioners and will grow the fraternity moving ahead. Thank you so much for your time,
So,
and looking forward
sorry,
to have
sorry, Dr.
you.
Piyush. Actually,
Yeah,
before
sorry.
concluding, two more
Sure,
points I want to highlight. I
sure,
think you have
please.
brought very important or critical point, that the many times our medical rep teams and all these people, they are failed to, share the benefits to the doctors because of lack of, the positive time or whatever the issues there. So just I'm very glad to announce that part also. Every 15 days we have planned to organize one webinar session on our different products. So we will keep on sharing some kind of brand benefits of our. Not only that, we will also share the some difficult case studies, some FAQ sessions. So every 15 days we are planning to organize such kind of sessions. The second point I want to mention is that last 40 years our organization has worked a lot and established itself in a very quality medicine company, we in this kind of aspect. But now the next 4 years, it's a time to spread the awareness of these brands, and for that I appeal all this medical fraternity, so please join hand with us, and please extend the benefit of the products to their patients. So thank you very much, sir. Thanks a lot.
Thanks, Mr. Deepak, and thank you for having this session with us and giving your valuable time. Looking forward to have many more like this with you and your team. And thanks
Sure,
all the
sure.
doctors and all the professionals who always supported us. Today also I was seeing lots of people were there as live as well. Please feel free to connect directly with Marishi team, and we are here also to help you in any aspect. And looking forward to grow and prosper together. Thank you so much. Have a great week ahead. Thanks.
Thank you. Thanks a lot.